While health systems are experts at caring for patients when they're sick and in the facility, they're not adept at actively managing patients when they're at home. But to scale your remote care management approach for thousands of your patients, to keep patients engaged month after month, and to provide that care profitably takes much more than a nurse in a chair. This requires a platform where an experienced team of nurses use purpose-built technology to efficiently operate as an extension of the physician's practice. SignalAmp has cracked the code. We've made the investments and built the remote care infrastructure that is ready to scale your program day one. Let me show you. EHR Workflow. We know your workflow is sacrosanct, and there is no time for disruption or provider busy work. Your EHR is the record of truth and the only way to efficiently collaborate with your care teams. Each patient interaction is documented in your EHR. Quality measures and medrecs are attributed to the provider of record while accommodating provider preference. Patient enrollment. Informed consent is required from each patient. This is a significant administrative undertaking where every detail is important. Our enrollment team brings your organization a scalable process where each enrollment is highly scripted, monitored for quality, documented, and followed by a letter to the patient confirming the same. Finding and training nurses. We enroll 100+ patients per day for our health system clients. That's at least one new nurse every week. SignalAmp does all the hiring, onboarding, and training. With our remote care model, we can recruit from beyond your region to find nurses with complementary language or cultural skill sets, or wherever the best talent resides. Our nurses are our employees, allowing us to hold each nurse to the highest quality standards. IT connectivity. A remote workforce is not just about having a home internet connection. If users are rural or share bandwidth with a teen on Netflix, EMR connectivity drops and user experience suffers. When managing a remote clinical workforce, IT challenges quickly multiply. You need a responsive and dedicated IT staff, otherwise nurse uptime drops dramatically and with it productivity. Managing productivity. You cannot financially sustain a remote care program on the modest reimbursements without daily and long-term patient retention. Skimp on quality and providers and patients will not stay engaged month after month. We balance these often competing metrics. We share the revenues from successful patient engagement, and without enough output and long-term retention, our financial model collapses. We stand by our references on quality, but if you're unsatisfied, you have a 30-day no-risk out. Patient panels. For a typical in-house care management nurse, they are managing a handful of the neediest patients during an episode. SignalAmp has scaled to the point where our nurses bill about 400 patients in a month using our stress-tested platform for long-term engagement. Outside your offices, patients aren't as easy to reach. You're working on patient time, and you have to provide quality, consistency of effort, and value, otherwise they don't engage. Here's Jen again, working with her patient. She knows there's a whole team hard at work to make her job solely focused on providing the best patient care. This unseen foundation allows SignalAmp to customize care management programs for providers and patients, scale it across any organization, and make it immediately profitable.